this computer. Well, hi, Kelly. So thank you for meeting with me. I've gotten very little time to talk to you, but I have to tell you, you're a sister from another mister. I think you're brilliant. I think the culture that you're trying to put out there, facts, not fear, huge fan of your message. And so when I got a chance to talk with you today, I'd like to kind of uncover some things. So here's what I did. I got to fess up. You are on Facebook. I
That's
put you
okay.
out on my face. I know that you're not really, but I put you out there on my Facebook page because I really liked the message that you gave when you said, here's what we know about coronavirus. That's how you started that video.
Yep.
And I loved it, loved everything about it. And so the people that watch me and know me, they're going to want to share and they're going to comment and they're going to, which I love about that. And I hope they do, because this is the truth as you, now, no one else can tell what your agenda was except you. You're the author. And I said you didn't have one. Tell me where I'm wrong.
Well, here was the agenda. There was an agenda. I suppose there's always an agenda to anything, Bruce. And thanks for asking and being willing to have this chat. But the agenda isn't probably what an awful lot of people think. The video that was made that has caused so much sort of stir recently was made back on June 13th. I was approached out of the blue by someone who I don't know personally, but who follows me on Twitter, which is my only social media format. As you said, I'm not on Facebook, I do Twitter, but that's it. And I was approached offline by the pastor of a huge evangelical church in Arlington, Texas.
Oh.
And he asked me specifically, he said, I follow you on Twitter. I really like what you're saying about COVID. I like your sort of apolitical stance on it and that you're just reporting facts. And he said, would you be willing to make a video for our congregation? He said, a 15 to 20 minute video. Here's what we want to do. He said, we are looking at reopening. And this was before Governor Abbott in Texas had actually put through the reopening order. So he said, we want to reopen and we want people to feel comfortable coming back to church, coming back to worship in person, and to do so without fear, without needing to wear masks, and without concerns for the safety of themselves and their family. Furthermore, apparently this congregation has a large private school associated with it. And they wanted likewise the parents to feel comfortable sending their kids to school. Yeah. So I said, sure, I'm happy to do that for you. And I appreciate that you find my voice helpful. So I wrote the script. I hired a videographer on my own dime because I have some connections in that business in Southern California. And I made the video and I sent it to this pastor and they played it, I understand, on their Jumbotron at their church services the next week. And it was apparently hit the mark for them and made people in their congregation feel very comfortable both in going back to church and to getting prepared to go back to school. Unbeknownst to me, the video, as these things happen, went viral, quote unquote. People started posting it and sharing it with neighbors who weren't in that church and sharing it with schools.
I did.
So yeah, so that's what happened. And then the next thing I know, I was getting inundated with emails and calls. It's remarkable how easy it is to get people's contact information. And largely, Bruce, the feedback was remarkably positive, not just positive, but overwhelmingly positive, grateful. People saying, thank you for doing this. Oh my gosh, it's the first time I've understood what an antibody actually is, or it's the first time I had any clue how a vaccine works. Right. Those sorts of things. And so people, and what I've said to people is that the fact that the video went viral, I think is less a testament of me, Dr. Kelly Victory, and more to the fact that there is a vacuum, this hunger for real, tangible, digestible information about this, because everyone in the country has been living in this sort of swirling pot of misinformation and, more importantly, fear. And so insofar as I was able to allay people's fears a little bit, answer some questions to say, no, this is how this works, and here's what we're doing that's right, here's what we're doing that's wrong, and to try to remove some of that sense of desperation that really I was seeing fall into people's lives. So it has taken on, the video has taken on a life of its own.
Yeah.
But there was no political agenda. It wasn't made for fame or fortune. I did it for free, as I said, and it was done truly as a goodwill gesture to a congregation that was desperate, amongst other things, to get back and be able to worship in person together.
Yeah, if you would have told me in January that the government is going to be able to keep you from going to church for the next 4 months or whatever,
Right.
I would have said, how? That doesn't even make sense, but somehow
Exactly.
it's become something. And I understand. And then there's been some fallout from that. And I know that people have debated with me. I know that people are kind of on that fence of, do they want to just cancel me because of the same thing and my voice on these things? And I've basically taken a stance that it needs to be more science-based and less fear-based. But that's not what they hear. They hear that if I'm not completely for them and for the current narrative, I am somehow against them. I'm actually hostile to them, which is not my way either. And
Right.
I think we both understand that. And that wasn't your way. But there have been people, and these are people that are absolutely out there too far, but are usually, I don't want to say it poorly. So let me just say this. Let's ask the question. What happened? There's been some fallout. Tell me what happened.
There's been a lot, as I said, it's been largely very, very positive. And I've done not only conversations like this one today, but I've done I normally do a lot of radio. I actually do a daily radio out of Los Angeles, and where I take questions from callers and answer questions about COVID. But since the video came out, I've been contacted from people all over the country, primarily asking for help to meet with either community leaders that are trying to get reopened, with school boards trying to make decisions about whether to go back in person, with attorneys who are filing class action lawsuits against different government mandates. So it's been really a very busy time. But there's a very vocal and very hostile 2%, Bruce, that not only have problems with what I'm saying, but find it absolutely intolerable that I'm saying it. I have no problem with people disagreeing with me. In fact, I ran a large company for years as a physician, and I had a little sign, a little placard on my desk that said, "Tell me why I'm wrong." Tell me why this is a bad idea, or tell me why I'm not thinking about this correctly, or tell me why I've misinterpreted what looks to me to be the data. So I have no problem with people disagreeing, but there's a difference between disagreeing with someone's opinion or someone's interpretation of data or somebody's understanding of the science than saying, you're a bad person for believing that, or saying what you're saying, you are evil, you are selfish, you are uncaring, you have an agenda that is nefarious, or somehow, and that is what I find just so surprising and so frankly disturbing and disappointing.
Yeah, and that's the thing. I mean, you've had people call against your license. They've used, honestly, they've used the health board as a cudgel, anything in the world they can possibly do to harm you. And that's not what usually the people that act like this today are not usually the ones that have acted like this at all in the past, or at least in this particular case, I find it to be odd. I found recently, one of the things that my dad always said to me was, it is amazing how people who are asking for tolerance are very intolerant these days. Just before he passed, that was one of the problems that he had with what was going on. And me too. You spoke to a lot of things that are very important to do, because what is a mask designed to do? If you were to believe the current narrative, a mask is designed to protect you from getting this disease. Okay, so let's pretend that that's possible. Okay, I don't care if it is or not. I'm just going to leave that to the epidemiologist. Let's pretend that that's possible, whether it is or not. Okay,
right.
Good. What else could you be doing that should be at the top of that list, in my opinion, has always been my position. Are you drinking enough water? Are you getting outside, getting sunshine? That Indonesia study on vitamin D, right? Are you getting vitamin C and zinc that you can absorb? I'm not saying I don't sell one of these products. I say, hey, look, if you want some, here's a place where I get mine, but go get it, right? I mean, this is kind of where I was with this. And all of that stuff, how are your thoughts? And so this show has always been about joy, love, laughter, and science. And one of the things that we look at is how you sleep, how you think, how you eat, how you move. My problem was the how you think can put you in a state of decreased immune function. Mm-hmm. Let me just say that. Hostility, anger, anxiety, all of these have been well known to decrease your immune function. And so I've been trying to preach to, hey, this is something we need to change. How you eat, really big idea. You're an athlete, for example. I mean, you're one of those people that actually practices what you preach, and I'm actually very respectful of that. Let me just ask it this way. How important is it to look at sleep, thoughts, food, and movement in any environment, but especially one where there's a pandemic?
I think it's critically important, and that's why I have found the response, our national response to the pandemic has, if anything, Bruce, done harm to all of those things. So when people say this is an unprecedented virus, I say, no, the virus isn't unprecedented. We have had lots of viruses that come along and lots of pandemics, and they happen all the time. What's been unprecedented is this response, specifically because not only is much of what we are doing in response not helpful, it's actually harmful. If you think about, first we told people, oh, big groups, scary, can't do that. Don't go to church. Stay away from friends and family. Stay at home, shelter in place. That's one thing to do for a week, 10 days. Weeks on end, people start becoming very isolated, feeling very alone, feeling desperate and hopeless, and their stress levels go up. People start eating and drinking more than they should, rather than getting out and, for example, going to a barbecue that we might normally do in the nice warm weather. People are sitting on their sofas eating chips and watching reruns, binge watching on Netflix. Not for a week, not for 10 days, the way you might if you were injured or convalescing, but for weeks on end with no end in sight. We've taken children out of school, out of their normal social interactions. Anyone who has kids knows how critical structure, routine is to a child. We've thrown them into total turmoil with no structure. Mom and dad are both home. Tensions are high. We aren't letting people get the amount of exercise, that they normally would. People who are normally getting to the gym. Think about the elderly people whose only form of exercise is perhaps water aerobics. They closed all the community swimming pools.
I don't ever want to speak over you. I just love you dearly. But interaction, I go to a community center and it's bridge. They're playing cards. Right. They're playing something. It's interaction. They're all around each other in this situation. And there is no interaction anymore. Sit at home. And I've got a friend of mine whose parents are elderly and have been in a retirement home, and they are locked down. They don't even let them out of the room to roam the halls. Prisoners get to go out to the yard once a day. So I struggle with this. I really do.
No, so it's heartbreaking. So all of those things, we're doing all those. And then to absolutely put the icing on the cake, if you will, there's a mask mandate.
Yeah.
So on top of everything else, we tell people now actually close yourself in, rebreathe over and over again, everything that your lungs are trying to expel. The lungs, to make it most simple, have two primary functions. One is to bring oxygen in and replenish our cells on a minute-to-minute basis with oxygen. The other is to expel things out, which includes carbon dioxide, plus particles that we don't want to get in. Pollen, dust, allergens, all kinds of other environmental things. When you trap those things in a mask and rebreathe them, the very next inhalation, that over time is very dangerous. It really is.
It's been Ford, and I like Ford. I'm not saying anything bad about them, but because of what they were asked to do, it's 107 degrees in that place. There's no air conditioning. There's fans.
Right.
They have
Right.
these masks on while they're working. Now, I totally understand. You're a surgeon. I know that you've done this. That's different. What's the temperature of a surgical theater, though?
Actually, other than when you're treating burn patients where they increase the temperature, operating rooms are very cold. Specifically, we want to slow the patient's metabolic rate. We want to slow things down. So your average operating room is probably around 60 degrees, if not quote 58 degrees. And with rare exception, only when we treat burn patients do we increase the temperature. So it's not nearly so problematic from a temperature perspective for surgeons. Furthermore, surgical masks, Bruce, are intended to be worn in a sterile environment. When I'm in the operating room with a mask on, there isn't pollen and dust floating around. Those are sterile environments. So the pores of the mask don't get clogged. When you wear one outside, and bicycling or going to the grocery store and wearing them for hours on end out in the environment, they get clogged very quickly. And all that means is that you then start breathing around the sides.
Yeah.
You start sucking air in from around the sides. So you're really, they aren't functioning the way people believe that they are functioning. And then the idea of swaddling your head in a bandana or all of these cute homemade masks that people made. And I give people a lot of credit for being creative. If nothing else, they've gotten their sewing machines out and they're being creative. But they aren't intended for the healthy. Masks are intended to be worn by healthcare workers when they are in close proximity with people who are ill, or for the ill so that they keep from spewing out any possible viral particles, okay? Or for people who are at profound and significant risk for contracting it. Those categories, it was never intended to have the masses wear masks. In the same way, there is no such thing as quarantining the well. Quarantine is something that we've done for the millennia. We've always done this. We've done it with tuberculosis. We did it with leprosy, leper colonies.
Sure.
We took people who are ill and we isolate those people. That's a tried and true public health concept. The idea of taking well people and quote unquote quarantining them or putting them into self-isolation that's what's unprecedented. This response is unprecedented, not the virus.
Yeah, and I think everybody out there, all of the medical docs that I've had a conversation with and so forth, feel like there's another verse to this song that we're just not being told.
Yeah.
Or if one side's singing that verse, then the other side's, singing the other verse. There's a fugue going on, and
Right.
and it's going to be what it is. We try very hard. This will probably start to change and so forth. Let me ask you just a tiny bit about the future. The American Pediatric Association came out and said kids need to be in school. I thought that was a very brave stance for them to take, but I'm kind of glad that they did in some ways. It's like they need to be in school. This is a big deal. I did an experiment a long time ago putting movement back in the classroom. We did a Propel program where we taught the teachers how to look for kids that were yawning or just something like that. And they'd say, okay, everybody up, let's get our step. We're going to clap and stomp and clap, right? And we would get them moving for a little bit. We would add 90 seconds to 3 minutes total of movement back in them. And these kids calmed down just fine, So letting a kid be a kid, I'm concerned about these children going back to school. But now you actually have, I would say, legitimate credentials about that. You've discussed this with schools before, yes?
Yes, absolutely. And we know for all the reasons. First of all, children are very low risk for becoming ill with COVID-19. That's a fact. We know it. The CDC acknowledges it. The American Academy of Pediatrics acknowledges it. Children are very low risk. If you take just the state of California, where I spend a lot of my time and do a lot of consulting, the state of California has acknowledged that they have not had one pediatric death. And when I say pediatric, I mean under the age of 18. They have not had one. Out of 9 million people under the age of 18 in the state of California, out of 9 million, they haven't had one death, okay? So to close schools when you have that sort of data just defies logic. There are profound impacts to children staying home from school, not only incidentally to the children, but the fact that if kids are home, a parent needs to be home if they're young children. So you're pulling parents out of the workforce. So part of my mandate in public health is that we have to look not just at each individual, and this isn't just a doctor-patient relationship in public health. You are required to look at the impact that any set of guidelines, mandates, responses, what is the impact on the public as a whole? Exactly. And we have to be darn sure that we aren't doing more damage by the response, that we aren't doing more damage to the rest of the people than we, as we try to look at one individual. So when I hear people say, for example, well, if we save one life, or if we prevent one child from transmitting the disease to his grandmother, then it was worth it. Unfortunately, that is not correct. That is not the mandate of public health, and we can't look at it that way. It would be like asking a soldier to say, well, we'll go into that battle, but only if you can guarantee that no one will be injured or die. That's not a possibility, unfortunately. And that's what we are required to do in public health, is to make those tough decisions.
It is a tough decision. And you've said this bluntly, and I'm going to say it bluntly for us. All lives are precious. That absolutely just is the fact that you and I live by. I told you what they're going to put on my tombstone. I mean, it is. The difficulty is what they teach you in doctor school. And I'm going back to an old MASH show that was really, really well said. And, it wasn't Colonel Blake. Colonel Blake actually said, we learn two things in doctor school. First, one is people die. Two is doctors don't get to change one. Right. So that's just how it goes. And that is such a difficult thing for us. I know you feel that way. You have emoted that throughout all the stuff. It is tragic, and we need to support and care for the people that are at risk. I think that's okay. So here's something that I posed, and I would love to, I haven't told you about it. We didn't script this. So here's the thing. Here's the thing that I posed. I posed that cancer has 1 through 4, doesn't it? Stage 1 through stage 4. Yes. There's some zeros, but you get what I'm saying, right? Murder has 1, 2, and 3, right? How about COVID-19 gets 1 through 7? How about that, right? So it's not going to be as sexy in the news. It's not, right? But you speak to this in your word cases, the word cases, okay? So COVID-19, one is they don't know they have it. They just don't know, right? By the time they get to 4, they actually should be going to the doctor, at least staying at home because they're sick, and they know they're sick. You get to 5, you're going to go and get some medication, go home. 6, you're going to stay some time you get what I'm saying? 7, you're intubated. Sure. So if they could give a number, if they could kind of delineate that out, COVID 1 through 7, hey, listen, today we had 100,000 new cases. 99,418 of those were COVID 1 through 3. Right. And then you had these and then these 26 are on intubation, and they really require your support and prayers. I think it would help our healthcare heroes, the ones that are actually out there trying to solve these problems for people and so forth. I really do think so. And then I think the big push needs to be, here's how you protect you, not your community. Here's how you, Mrs. Jones, Mr. Jones, here's how you protect you. Drink some fluids, go outside, right?
Right.
I want to promote that message. Speak to the word cases. We're seeing there's more cases now, and the people latch onto that word.
It's a great question, and that's what I'm spending most of my time, Bruce, talking about, is the misinformation about the data. And it's not the public's fault, because they are being beaten over the head with it, minute to minute, hour to hour, by everything in the media and even by our public health officials. There's been an uptick in cases. We've had a spike in cases. Well, let's talk about what cases mean. First of all, the case number itself, I believe, is highly distorted or suspect. My standard line is, the virus is real, the statistics are not. And here's why I think that cases are deceiving. First of all, the case number is a compilation of people who've tested positive. Many people get tested more than once. Most people, if they get a positive test, before they can return to work or feel comfortable going back out, they get tested again. So if somebody, say I go and I get tested and I'm positive, a week later I go get retested, I'm still positive. A week later I go get retested again, I'm still positive, and I'm not negative till the 4th time. I get recorded as 3 separate cases. I'm one person. How can Kelly Victory, one person, be more than one case of COVID? But this is happening all over the place. And there are patients who've been tested as many as 5, 6, 7 times before they turn negative. Then many states, including places like Texas and Florida, are lumping together positive antibody tests into the number of cases. Well, that's frequently the same group of people as well, because they get over it and then they say, I want to know if I've got antibodies. They get tested. Now they're another case. Furthermore, the antibody tests simply are not as specific as people would like you to think. Coronaviruses are very common. Upwards of 20-22% of all colds are caused by coronaviruses. So some of the antibody tests are coming back positive because they're reacting from previous coronaviruses that you've been exposed to. And then to make muddy the water further, many states are lumping in cases of presumed COVID. I mean, no test was done at all, not an antigen test with a swab up your nose or an antibody test, but the person had symptoms that were considered to be consistent with COVID, meaning fever, shortness of breath, cough, those kinds of things. So those numbers get lumped in. So the case number by itself is almost meaningless at this point. Furthermore, it's irrelevant, Bruce, if it doesn't translate into people becoming ill. If all of these people are positive, but are going along with their way, people, I say, well, great, how do you feel? Were you sick? People, 85% of people are saying, I didn't know I had it. I felt fine. I didn't even have as much as a sniffle. So if the cases aren't translating into people being ill, let alone being hospitalized or needing the ICU, those sorts of things, putting pressure on the hospital system, pressure on the healthcare system, then I really implore people to stop looking at the case number. Stop paying attention to it. Look at the trends that are going on in the hospitals. Are the hospitals being overwhelmed? Are people dying of this? Are people suffering and needing to be in prolonged hospitalizations? Those sorts of things. And across the board, those numbers continue to be on the decline. So the case number sounds scary. People are focusing on it because they have no choice. It's being repeated over and over again. Tragically, governors and other leaders are making decisions, whether to shut down schools, shut down businesses, recreate lockdown situations on the basis of these numbers when these numbers are simply not relevant.
Yeah, so we had something happen, and I know what you're saying is actually true because of someone that we know. We did have a doctor that I know that was contact traced. Now, I didn't know they were doing that to this level, but he was called. So the Department of Health called him, said, you've been in contact with a person that tested positive for COVID. Somehow this contact tracing went forward. They were told, you got to stay home. He's like, I'm absolutely fine. I feel terrific. I don't have a problem. Checked for fever, did everything he was supposed to do and said, I'm not going to change my world. This person does not work for me and is not in Kansas City, Missouri. It's important. Otherwise, they're going to feel like, oh, maybe he did something wrong.
Right.
That's going to be to somebody else's judgment. I'm going to leave it alone, right? But here's the thing. He just went ahead about his business, said, boy, if I feel bad, I'm absolutely going to stay at home. Really logged into his body. How do I feel? Took extra vitamin C, zinc, good water. He makes it 14 days, of course, later. He's like, no, I feel fantastic. There's nothing wrong with me. So he does what he's supposed to do. He has to call back. Now, I didn't know this. They don't call you. You got to call them. So he calls back and he says, hey, it's been 14 days and I feel terrific. And they said, okay, well, we will take you now off the contact tracing list. And he said, just curious, if I'd had a fever or a runny nose or something like that, or a cough, what would have happened? He said, well, if you have any symptoms that are possibly COVID, it would go down as a possible. And in today's epidemiological theater, we have to call that a positive COVID.
Right.
And he said, you're kidding me. If I had just had, do you realize that there's this Godzilla event from the Sahara Desert right now coming across middle America? You probably heard about it, right? All the dust.
Yeah.
Right? So everybody right now has a little dizziness. They all have a little ringing in their ears from allergies. I got a runny nose. So anybody could, and he said, that is odd. She just said, listen, that's what I'm supposed to say. He posts a video of that. He's upset. He posts a video of that on his Facebook page. It gets 1 million hits. Because people are looking for truth. They're looking for information. There's a lot of people that feel like something's being rammed down our throat for a reason we don't quite understand. were this bastion of truth, in my opinion. Of course, it's an echo chamber. Everything you're saying is exactly what I say. So people have to take that with the grain of salt they want to, but you have good, solid reasons for your opinion. So do I. And so what I would like is that they would come back with data. Well, here's the data that I'm looking at. What do you think about that? And you know what? Even if you did totally disagree with me, it doesn't make you wrong. That's the problem that I'm running into. That's the mental health portion of this that scares me the most. Facts, not fear. Hey, these are my facts. What do you think? In any marriage, let's just say in any marriage, two things every marriage counselor is going to say: don't bring up the past. It doesn't do you any good. And argue the facts and not each other.
Right. No, and this vilification of anyone who has a different idea from you, that you somehow, that person is evil, is so odd to me, because I pride myself in being able to have a meaningful, critical thinking and meaningful dialogue with people, and argue along the facts. I've spent a tremendous part of the past 2 decades of my life immersed in disasters. I'm a disaster preparedness and response expert, and I've spent my life, on scene at places. And one of the things that I love about it truly is that in the worst cases, whether it's a flood, an earthquake, an active shooter scene, whatever it is, I never cease to be amazed and frankly humbled by the goodness of people, by the willingness of Americans to sacrifice, to give for strangers, to be absolutely selfless when they have lost everything themselves, but to figure out how they can help a neighbor. What Americans really don't like, Bruce, is feeling duped. Yeah. They don't like to feel like they have done those things. They have sacrificed, they've stayed home, they've worn masks, they've lost businesses, and then find out that this wasn't really, that these decisions weren't being made on righteous data, that the science was not being followed, that they were being asked to do these things needlessly. People really feel badly about that, and we lose the public trust. So my goal in all of this has been to say, hey, Americans will sacrifice. They will. We will pull together. We always have. We are good people. We are unbelievably selfless as a population. But don't lead people down the primrose path to believe they're doing right and then let them find out that in fact the numbers have been cooked or were incorrect, or that all these deaths, for example, had never actually had COVID tests, and that these people are dying of something else. Another thing that you're not hearing reported in the news appropriately, and I think it's causing a lot of fear, and again, we should get back to the issue of acting out of fear, is the issue that the hospital systems are overwhelmed. You hear a lot, there's an increase in cases of COVID, and we're seeing an increase in hospitalizations. Well, those things are both true. We're seeing an increase in cases, and we've talked about why, in addition to the fact that we're testing hand over fist now, people. The increase in hospitalizations, almost across the board, aren't COVID patients. They're what I have termed COVID lateral patients. They're people who are ending up at the hospital quite ill because they delayed getting medical care that they needed. They didn't keep their appointment for their mammogram. They didn't follow up with their diabetes. They skipped the last 3 cardiology appointments for their congestive heart failure. And they're showing up in the ER very ill and needing to be admitted. And so we're saying to those people, why didn't you come 2 weeks ago? And they're saying, because I was scared. Yep. Because I was afraid I was going to get COVID.
We hear it too.
Because I didn't want to put, so the stress on the hospitals right now, there is an increase in hospitalization, but an awful lot of those people aren't COVID patients, they're COVID lateral damage, people who delayed care. And that is something that people need to understand.
So how is it that I heard in the media, and it was brought up when I posted your video, how is it that somebody said 56 ICUs in Florida are overwhelmed? They did not say ever that they were overwhelmed with COVID patients. They just said 56. Did you read that? Have you seen?
Yes, and I follow that data quite often. So a couple things more about the hospital loads. So there's, number one, that significant issue that the increases in ICU utilization and hospitalizations in general is profoundly impacted by the number of people without COVID who needed to get in. then you'll recall there was a long time, 3-month moratorium on elective surgeries.
Right.
So all of those people are now getting their surgery. So a lot of the hospitalized patients was from this huge backlog of people who had put off their hip replacement, put off their hysterectomy, put off their whatever that they were getting done because it was deemed elective. And now they're back in the queue. On top of that, the average person, the headline almost commonly reads is, oh, ICU is at 92% capacity. They only have 8% capacity left, or something to that effect.
Right.
People need to understand, that's their sweet spot. Hospitals aim to run their ICUs somewhere around 90 to 93% capacity.
Right.
Other than that, the hospital is sending nurses and techs home. Okay, hospitals aim, that's their sweet spot. So every time I read a headline that says, oh my gosh, it's at 90% capacity, I think the CEO of that hospital is saying, phew, we can actually keep the lights on. We've got enough patients. That's where we want to be. This is what hospitals do all the time. It's a constantly moving chessboard. We move patients from the floor to step down, to ICU to step down, from the ER to the floor. And real time, there's somebody whose job it is at every hospital, Bruce, to manage bed counts. We do it all. This is independent of COVID. This is one of the core functions of how hospitals work, because they aim to stay at that 90% capacity level. That's their sweet spot. Yeah,
that's kind of what I've understood as well. I've had other people tell me that. I have medical doctors that work for me that actually echo that. They said, well, actually, that's kind of where they're supposed to be.
Right.
This overwhelmed or overrun is not a truth. It's being said differently. It's being offered differently. So I think what worries me the most and what worries you the most is that we're in this fear-based system. And so fear leads to very poor decision making. And you spoke to that. And so I'm not going to steal all of your time, although I love you for doing this with me. I'm going to ask you one more piece, though. Speak to making decisions in fear. You are disaster recovery. You are an ER person. You are trauma. All of those wonderful things that help people, I should say, get out of those states. Talk to me about making decisions based in a state of fear.
Well, you're exactly right. And I teach a course on leadership in times of crisis. If I had to distill that entire body of knowledge down into one thing, it's the idea that in times of great stress or times of threat, people become fearful. And when you are fearful, when you are in panic, you make very poor decisions. You are not able to think clearly or to make good decisions. And you sure as heck aren't in a position to lead. So that's why we tell people, count to 10 before you do something. Have a friend read that email before you hit the send button.
Yeah.
Don't answer. Don't respond to your spouse. Count to 10 before you clock your kid because he or she did something. Yeah, because when you are in that state, that angry, hostile, or fearful state, you are not in a position to either 1, make good decisions, 2, to control yourself, or 3, to lead. And unfortunately, what I see happening with this COVID pandemic is an entire country that is swirling deeper and deeper into desperation, hopelessness, and fear. Fear for themselves, fear for their families, fear for the economy, fear for our future as a country, fearful of everything. And the more we isolate, the more we stay home, the more we focus on these little data, these bits of data that we are constantly getting barraged with from the media, people are becoming more and more fearful and are making, therefore, worse and worse decisions for themselves and for their families, and certainly at the national level when we are seeing this from our leaders. So I would implore people to take a step back, do those things, as you started at the beginning, that we know will help you to not only combat COVID-19, but I promise you the next thing that's coming down the pike. Yeah. All those things, adequate sleep, adequate exercise, a nutritious diet, keeping your stress level down, getting together with friends and family, worshiping if that's your thing, meditating if that's your thing, doing those self-help, nurturing things, because I promise you, after COVID-19, there will be another thing out there. The reason that we haven't been wiped out as a humanity is because we have highly functioning immune systems. We can work to fight these things off. We can rally around and protect that relatively small group of people, frankly, who's actually at significant risk from this particular virus. Protect them, rally around them, support them, and then the rest of us get about to the business of running our lives, supporting our kids, getting our businesses back up and going, and being ready, not fearful, cautious, aware, looking at the information, being open-minded, not trying to silence everybody who might disagree with you about something. You might actually learn something. And when people question me, which happens a lot, if I could see through the attacks and the threats and the sort of, what a horrible person I am, if they make raise a legitimate question, you better believe I go and look it up and I think, wow, maybe I misunderstood that, or maybe I have the science wrong, or maybe I need to re-look at that data and see if there's a different way to interpret it. But that's what makes American healthcare great. It's what makes us great as a country. If we start silencing one another, we're no better than the countries that we tend to criticize, and we need to do better than that.
Yeah, we don't want the draconian measures. We don't want the teachers holding people in detention because they touch their mask that's on their face during the day. This is part of the thing. What I'm finding now is that I have to admit that my own position is my own position. I have reasons for those opinions, and I can give the research and but that doesn't matter always to everybody as an expert, and that's fine, okay? But I look up what I look up and I say, well, this sure seems like this would not be good for me to be wearing a mask as physical as my work is. So I ask all of my patients, by the way, I do wear a mask at work. I do, of course I do. I wear a mask like I'm supposed to. I do everything the CDC tells me I'm supposed to do. I do all of that stuff. Okay, so that's a given. However, I've also found that it leads to almost a fanaticism. It's one of those things, hey, if you're not wearing a mask, I get to now dehumanize you. I get to abuse you as a person. I get to abuse your family. I get to just wail on you because you're not wearing a mask. Obviously, you don't care about old people and children, so you're just a horrible person. And so what I see is, and there was a time where we had Middle Eastern countries that were doing very poor things to each other. And then they started fighting infighting. And one of the things that happened was that there were fanatics, and then there were fanatics that were fanatics. And they were killing, no kidding, killing the fanatics because they weren't fanatic enough.
Right.
And once I started looking at what was happening there, I'm like, you do you. You do you. Don't pretend that this person can't be bothered to put a mask on. Don't pretend whatever that is. You do you. Shore up your own immune system. Well, obviously, we've both been abused for our points of view there. And all I can say is that I really do appreciate yours, and I appreciate yours coming from a legitimate authority. I look at the research too and came to the same conclusions, obviously. But I think if people want to argue us, that's one thing. If not, let's put this out there. I'm going to ask the people that see this, post it, share it, make it go whatever viral it needs to go, because it's two people having a conversation. And if you want to have a conversation with me, please do. And I just got to say that there may come some other things, and if there are, I'm going to call you back.
Anytime. I enjoy it. I think the dialogue is critically important. I appreciate it. I appreciate you reaching out. And I hope that the folks, your audience, will share it, because there's nothing out here. There is no conspiracy theory. There is no one, I'm not a denier. I'm just trying to get, like you are, common sense out there, calm some of the fears, get people to think a little bit more logically and scientifically about it. And if nothing else, be open to hearing that maybe there's a different way to look at this. And we want
our actions to do more good than harm. That's the thing. And if our actions to this point have actually, in my opinion, I hold the opinion strongly, so I have to be careful, have done more harm than good. And that's a real problem for me. And so when I see that, I feel like I need to speak up. And so maybe I want to do that now. I don't want to keep you forever, but I kind of do. So I'm going to let you go. Thank you
Well,
so much for this. And I just want to let you know that if you want, I'll send you a video of this so that you're okay with it. How do you feel?
You're welcome to post. There's nothing that we talked about or that I said that I don't stand by.
Okay.
So post away, and let's do it again. Let's circle back in a little bit as things continue to unfold, and maybe we can continue to address other questions that come up, or maybe you'll get feedback from people who see the video, Bruce, that make you think, wow, that's something we should talk about or address or clarify or whatever it is.
I agree, Kelly. I am all about it. Let's post it. Let's have it go out there. And if they want me to ask these questions of you, I certainly would. And certainly they can welcome to talk to me. Thank you so much. If you'll give me just a second, I'll stop recording and I'll keep talking to you.
Terrific.